Hello, my name is Haley Epperson, and I will be talking about Guillain-Barre syndrome. I am going to begin with the pathophysiology of this disease. It is a rare neuromuscular disease. It is an inflammatory disease where the immune system attacks itself, causing a damaging effect to your nerves, the myelin sheath of the axon, and this disease is typically brought up by an abrupt onset of symmetrical paresis, which is the weakness, and then it progresses to paralysis of the body. The spinal and cranial nerves are typically destroyed by an inflammatory reaction, and the peripheral nerves are infiltrated by lymphocytes, and this can lead to edema and inflammation. And then GBS occurs in two different stages. We have the demyelination, which is the axonal atrophy, and it slows or blocks nerve conduction, and this typically starts at the distal end and ascends. And then the remyelination, which is the resolution of symptoms, and this is a typical descending pattern. The etiology and incidence of GBS, it is an autoimmune response, typically from a viral infection or a certain vaccine. Although the exact cause is unknown, we have a common organism that has been found to be associated with Guillain-Barre's. This is called Campylobacter jejuni, which is also the organism causing gastroenteritis. This disease or disorder occurs in every 1 in 100,000 people, and both men and women have an equal chance of having this disorder. Although the most common age group is between 30 and 50 years of age. GBS is divided into 3 different stages of symptoms. We have the onset, and this typically lasts 24 hours to 3 weeks. There is an abrupt, rapid onset of muscle weakness, and muscle weakness can lead to the paralysis, and the amount of paralysis will determine the respiratory involvement. And then with the respiratory involvement, this will cause shortness of breath and inability to take deep breaths. And then it also attacks the autonomic nervous system, which causes the labile blood pressure, cardiac dysrhythmias, urine retention, or paralytic ileus. And then with the pain, it can be from a cramping to a severe pain. And then we have the plateau, which is typically 2 to 14 days. This is the most severe stage, but progression has stopped. And typically with the patients, they become very discouraged because they aren't getting any better and they feel like there's no hope left. And then our final stage is recovery, which is typically 6 to 24 months. This is when axonal regeneration and remyelination begins, and the typical goal for recovery is to go back to the function they once had before the disorder. Typically, the disorder can cause a limitation in the function that they had previously, but not in all cases. Some diagnostic tests of GBS would be a lumbar puncture, which is where they obtain the cerebral spinal fluid, and with the cerebral spinal fluid they have a normal cell count with an elevated protein. We have an electromyography and nerve conduction velocity test. This just tests the nerve conduction throughout the body. And then pulmonary function testing, this determines impending respiratory function, whether or not they are improving or declining. And then we will continue on, and I had a priority nursing diagnosis, which was impaired spontaneous ventilation related to weak respiratory muscles, as manifested by increased paralysis, shortness of breath, and reduced ability to take deep breaths. And typically with this, they also need to do a mechanical ventilation and intubation to continue to breathe. There are multiple treatment plans and support systems throughout this disorder. Our first one is plasmapheresis, and this is when they remove the old plasma and replace it with new. Intubation and mechanical ventilation. This is for people who are unable to breathe by themselves. It helps them throughout the process until they regain the strength to breathe on their own. We have the immunoglobulin therapy, which this will reduce the severity of the disorder. We give them anticoagulants to reduce the risk of DVT due to immobility, and analgesics to decrease pain that may be felt. We also need a provide emotional support during the plateau stage due to them feeling very discouraged that they are not getting any better or any worse. And then for the recovery phase, we also want to provide intensive rehab to have them regain the function they had once before. And then I have a couple NCLEX questions. My first one is Guillain-Barre syndrome has a largely unknown cause, but one organism has shown association with GBS. Which one? We have A. Streptococcus pharyngitis, B. pneumococcal pneumoniae, C. Campylobacter jejuni, and D. Streptococcus pneumoniae. Which one do you think it is? And we'll go ahead into my rationale and answer. The answer is C. The rationale of C is correct because studies have shown that Campylobacter jejuni has been associated with GBS, and the other ones have not. They are more correspondent with other diseases and disorders. My second NCLEX question is, in Guillain-Barre syndrome, what are the diagnostic testing that can conclude GBS as a diagnosis? A. Lumbar puncture with a normal cell count and an elevated protein level. B. A history of onset of symptoms. C. A lumbar puncture with increased white blood cells, increased protein, and a normal glucose level. Or D. Increased blood enzyme levels. Our answer is A, and our rationale is answer B is incorrect because this is to determine Bell syndrome. C is incorrect because this is how to determine encephalitis. And D is incorrect because this is how to determine ALS. Answer A is correct because it is the only one that determines GBS. And that's all I have for you. Thank you.